Okay, folks are quickly coming in, and given the time, we'll go ahead and get started. So hi everyone, I'm Dr. Rob McKenna, an advisor with the Health Resources and Services Administration, and it's my privilege to welcome you to this conference session, Telehealth Integration in an Undergraduate and Graduate Nursing Curricula. I hope you're as excited to be here as I am. This annual telehealth conference really is one of the best I've ever experienced, and I'm finding that it's equally awesome in virtual format as it is in person, so I'm sure you are as well. I'd like to remind you that we're using the conference app to receive and address questions, so please do enter your questions there as they occur to you. Go ahead and vote up any other questions you see that you'd like to hear an answer to or that you share, and we'll get through as many as we can during the end of this session. Alternatively, at the end of the session, at that time, you'll have the option of raising your hand and we'll unmute you to ask your question. We'll probably alternate back and forth. So we are fortunate to have this session's faculty sharing some of their experience with us. And that would be Dr. Gabrielle Abelard and Dr. Heather Hamilton, both clinical assistant professors at the University of Massachusetts Amherst. If you're interested in reading their fuller bios, know that you can do that by clicking on their names in the event app, where you'll see their large amount of experience. And so we're excited to hear from them, and thank you for being with us today, doctors.
Oh, thanks for having us. All right, so I'm excited to be a part of this virtual telehealth conference and to present the work that we're doing on telehealth integration. So next slide. So our objectives is to discuss the findings from an integrative review on the state of telehealth in nursing curriculum. I will also be discussing the outcomes and the impact of the integrative review. And my colleague, Dr. Abelard, will explore the effectiveness of using a standardized patient actor during simulation for telebehavioral health practicum. So the aim of the study is to find out what was missing from the literature, what was the gap in the literature concerning telehealth. So as we did our pilot program into our nursing program, I wanted to have some sound theoretical basis for implementing the telehealth program. So I completed the integrative review, which is what I will discuss in part 1, and Dr. Abelard will do part 2 of graduate education. And next. So the term telehealth, telemedicine, and telenursing is used interchangeably, but we know they're all different. But for the purpose of this presentation, my main focus is telenursing, which most people don't know about. So telenursing is the use of technology to deliver nursing care and to conduct nursing practice. Next. So these are the findings from the integrative review. So the first thing that we came across while we were doing the pilot implementation in our undergraduate program was that there was a lack of knowledge among faculty and students on the use of telehealth in nursing education. The second thing that came up in the literature and also from implementing the program in our curriculum, that there is no theoretical framework to guide telehealth integration in nursing. Also, from the literature, we were able to ascertain that the use of simulation is the best way to teach telehealth technique. And also that collaboration between faculty and student is needed in order for you to have a successful program. In addition to faculty and student, there needs to be collaboration between faculty, also collaboration between faculty and leadership of nursing education program, and then collaboration between clinical partners and nursing education in order for the implementation to be successful. Next slide. So in this section, I'll discuss the impacts and the outcome of the integrative review. So the first thing that I will show, which will be on the next slide, is the telehealth pilot integration. The second outcome of the integrative review is that a student, Lisa Barbosa, developed a conceptualization of telepresence. And at that time, I was the director for a simulation lab, and I assisted her with the research portion of the actual research, and we submitted that for publication. The integrative review was also submitted for publication. And from the integrative review, we know that there's no nursing framework for telenursing. So what I did was begin the process of developing Hamilton's telenursing framework, which I will discuss in another slide. So that manuscript is in progress, and I'm hoping to submit that for publication before the summer is over. Last year, we also submitted an internal grant for telehealth application into our nursing program, and it was not funded. So this summer, we're revising that grant, and the first part of the grant, we will conduct a telehealth needs assessment study of practicing registered nurse to assess their telehealth needs. And based on that need assessment, we will take that and develop a virtual telehealth symposium for nursing educators and nursing students so that they can gain the knowledge that's missing, that we found out that was missing from the integrative review. Next slide. So we wanted to share this with you. This is a mapping of telehealth in our undergraduate and graduate curriculum. And the important points to take away from this, in each boxes, we have the names of the classes and then the rationale for introducing telehealth. But what was important about the telehealth mapping is that it has to be done over a period of time in order for student and faculty to learn and retain the knowledge. So if you're in a 2-year program or a 4-year program, it must be weaved throughout the entire curriculum. Another important aspect of a curriculum mapping for telehealth, it has to be integrated into the theory classes, so where they can learn about policy and procedures regarding telehealth, learn about telepresence and the different aspects of telemedicine. And it also needs to be implemented in the clinical courses. And so we implemented it in our health assessment course, our medical surgical courses, and in our specialty courses such as psychiatry, and also our community-based class. And in our graduate program, Dr. Abelor will go into detail about how she implemented it into the psychiatric mental health nurse practitioner program. Some of the plans that we have is to implement it in our family nurse practitioner program and our gerontology nurse practitioner program. Next slide. So this part of the presentation I'm most excited about, and it's a Hamilton telenursing framework. So when developing this framework, I decided to use 2 important theory, a theory and a model. One is Peplau theory of interpersonal relation. Peplau is a nursing theorist, and her work focuses on the nurse-patient relationship. And so one of the main reasons why I wanted to develop a framework, because for nursing, most nursing work is grounded in an existing theory, and there was none for telehealth. And so having a framework is a way of explaining an interaction, and it offers a set way of conducting research or conducting clinical practice. So I wanted to develop this framework. So when using Peplau theory of interpersonal relationship, I took 4 paradigms of nursing, which is paradigms are what's used to guide nursing research, which is person, health, environment, and nursing, in order to discuss the different aspects of this telenursing framework. I also used the Loans and McLean model of information system success to create this framework. And at first I was thinking about using management information system, which focus on hardware, software, and data management. But when I thought about it, I decided to use the Loan and McLean information system success model, because it incorporates everything about management information system. So you cannot have a successful telehealth program without the management information system. So I think both these theory encompass everything that I wanted to share. So on the side is the model that I will use, or the logo that I'm planning on using as a telenursing framework. In the center of it is the nurse-patient relationship. And this nurse-patient relationship is important to nursing. And it's also important to the Loans and McLean model, because they talk about the user and the satisfaction of the user. And in nursing, when we talk about the nurse-patient relationship, we talk about building that mutual trust between the nurse and the patient, that level of communication, that level of trust where the patient feels as if they're having a face-to-face encounter, even though it's virtual. So you want the patient to feel safe with the provider. The second circle is the nursing process. The nursing process is an important, or I would say it's the basis for, it's the foundation for nursing care. Included in the nursing process, you have the assessment of the patient, then you develop the diagnosis, then you have to put a plan in place for the interventions. Next, you carry out the intervention, and then you assess if the interventions that were carried out is appropriate. In the third circle is data transmission, and that has all to do with telehealth, how the data is transmitted while the nurse-patient relationship is occurring and while the nursing process is in progress. So data transmission is extremely important. And then I'll talk more about data transmission as I talk about the 6 outer circle. So the outer circle consists of 6 concepts, because concepts are really important as you develop a nursing framework. And so I'll talk a little bit about each concept related to PEPLAR theory and the Loans and McLean model. So the first step is the policy and procedure. And these can be used interchangeably. It doesn't have to be policy first, then education first, because I went back and forth depending on what is it that you're doing or who you're teaching. You may want to start out with education, or you may want to start out with building your policy and procedure. So in policy and procedure, so PEPLAR doesn't talk much about data privacy, neither does DeLone. So in addition to building policies and procedure for a nursing education program, in this area, I think it's really important to talk more about data security, data privacy, HIPAA violation, and how to make or patient interaction HIPAA safe. So those are all important aspects, and it also depends on the state that you work in or live in or practice in. That's going to help you to develop your policy and procedure. The next step is education. So education is important in both aspects because you are teaching the user. And so if it's between faculty and students, you're teaching them. But if it's between faculty, you're coaching each other, you're mentoring each other. If it's between the faculty and the organization that they work for, you're looking for that supportive relationship from leadership. So it's continuous education. The other important aspect is telepresence. So how does our patient view us? How friendly is this system to the patient? Because if the patient doesn't find it user friendly, or they don't feel as if they have developed a rapport with the nurse on the other side, they're less likely to follow up for care a second time. So having that connection between the nurse and the patient, building that mutual trust is important through telepresence. The other aspect of the framework is assessment. This assessment goes back and forth between nursing and technology. But for the purpose of time, I'll focus more on the assessment portion of technology. An important thing to take into consideration is, say, for example, the megapixel of the camera. If a nurse is doing a consultation with a patient who has a dermatological issue, they may have to take a photo of the lesion. And so how that photo is transmitted does impact the diagnosis that the nurse makes on that patient. So we're looking for clarity of the photos that will be transmitted. It includes the bandwidth of the internet access that the school will use and the patient will use, because that does affect communication and how information is carried across. So the quality of the system and the information that's transmitted does affect the diagnosis and the intervention that the nurse will make for this patient. And that brings me to the part of data interpretation. The level of assessment or the quality of assessment will determine how data is interpreted. Because if the data is not transmitted accurately, then that can result in error. The last important step of the telenursing framework concept is data recording. Data recording can be divided into two sections. One is nursing documentation. There is a saying in nursing that goes, if it wasn't documented, then it wasn't done. So it's important that we have accurate documentation. And also, if there should be any kind of data recording of the interaction, then it's consented by the patient and the provider, and that it's stored in an HIPAA protected manner. Next slide. So again, this is just breaking down the framework as well. So we'll see for the 3 inner circle section, I put that in an arrow, which is the nurse-patient relationship, the nursing process, and data transmission. So these 3 things are occurring at the same time during the telehealth encounter. But during the policy and procedure, there's a policy and procedure for every aspect of it. There's the education aspect of it. There's the telepresence, where the nurse has to communicate with the patient what's the expectation for the session and what can happen. And again, same thing with the assessment. You're constantly assessing your patient's interaction. You're assessing, is this patient comfortable? Is the patient getting what they need? And so this is all a part of data interpretation and data transmission, and also recording the information that is shared with the patient and your observation of the patient. Next slide. So based on our outcome and impact of the integrative review, I felt like I've done or begin some good work regarding research of telehealth in nursing education. So my future plan is to develop a telepresence framework where I could learn more about telepresence, because I think telepresence has a big impact on whether a patient will choose to use telehealth in the future. I I spoke to one patient this morning who's a relative of mine, and she had to use telehealth, and she's like, oh, I don't like telehealth because I had swelling and the doctor wasn't able to feel my swelling. Even though he was able to take pictures of the area of my body that was swollen and was able to tell me how severe the swelling was, but I just wanted him to like touch my skin to see see how bad the swelling was. But I think her physician was great in the fact that he was able to accurately diagnose her. And so I encouraged her and told her that was a good thing. So I think I helped her alleviate some of her fears, knowing that even though you're not having a face-to-face interaction with the doctor, you know, the level of internet quality that he has or the type of equipment that he has is very significant in helping him choose the right diagnosis for you. And so I felt like she felt confident that what the physician did was great, and felt as if she would use the service again. So I think part of it is us as provider just educating the patient on our capability and the abilities or the things that we can do regarding telehealth. The next important aspect of a telepresent research plan is to develop an instrument. And the purpose of that instrument is to evaluate nursing student use of telehealth. So the first part was to do, which we will do this summer, is to do a qualitative study of practicing nurses to see what are their needs assessment. And so based on that need assessment, we're going to be using some of those same data to develop the nursing instrument. The instrument will be divided into two parts. The first part will focus on telehealth and telepresence. So we will assess students on their telepresence. We'll assess them on their ability to use the equipment, because if you don't know how to use the equipment well, then that can affect the smooth transition of your interaction with the patient. The second portion of the instrument will focus on the nursing process. Are they assessing the patient correctly, creating the correct nursing diagnosis, implementing the correct plan of care for the patient, and then evaluating the patient? So this will be a reliable and valid method of evaluating student during the telehealth encounter in a nursing education program, whether it's in simulation, in a simulated form, or if it's out in the community. At our university, we have the B3 box where students can take the box out into the community. It's HIPAA protected, and they can provide care to patients out in the community. So it was piloted in a simulated fashion and also in an actual real setting out in the community with patients. The last plan that we have for this telehealth research is to seek approval from the university for full integration of the telehealth across our nursing curriculum. Next. And so this part 2 on graduate education, Dr. Abelar will present. You're muted.
Thank you, Dr. Hamilton. I'm so thrilled to be co-presenting with you today. And so my name is Dr. Gabrielle Abelard. I am the owner of Abelard Psychotherapy. We provide psychotherapy and medication management to individuals across the lifespan. We do that both virtually through telehealth, and we were, prior to the pandemic, doing in-person face-to-face visits as well. I have the opportunity to coordinate the psychiatric mental health nurse practitioner, Dr. DNP program at UMass. And we provide education to nurses in 2 different programs for students who are interested in getting a doctor of nurse practice, and also sit for the certification exam, and also for advanced practice nurses who are hoping to get psychiatric certification as well. So I am delighted today to talk to you about two projects that we've been working on in the last several years. So if we can forward. So the first is regarding a synchronous simulation using a standardized patient actor. We did this both in person and via telehealth. And the first year was really exciting because we had a small grant that helped us fund and pay for a standardized patient actor. And it was pretty cool to kind of create it and evolve it with students. And then the third year, ran out. And so I had to be really creative in terms of understanding that when you're teaching online, and we have students from throughout the United States who are in different locations and in different time zones, how can we meet their need to give them really good education and also what clinical skills were. So we decided to use VoiceThread. And to the right is a picture of our center at UMass. We have a wonderful telehealth practice setting, and that's where our first project took place. Forward, please. Forward. Thank you. And so for the simulation using the standardized patient, we had objectives that included providing 6 of our students a case assessment interview. And these were students participating in a complex health course in their fall semester. We wanted to assess the effectiveness of utilizing a standardized patient actor. And we did this either face-to-face or using telehealth. And what we hoped is through this project, we would learn how can we continue to offer simulated activities, what are the needs and what areas to concentrate in. And you can see on the right is how our groups are broken down. And interestingly enough, that particular year, we had 3 students that were out of state and 3 students that were in state. So we decided that the 3 students in state would drive to our center and participate in person with our standardized patient. And then our other 3 students who are out of state would participate in the telehealth encounter. Forward. Thank you. And so the background is, and my colleague, Dr. Hamilton, talked a little bit about this, is that in terms of research, there is some research out there, but in particular, when you look at the graduate area, there really is not a lot when it comes to simulation-based learning, especially with a standardized patient. So it was important for me to not only create this activity, but to also assess the efficacy of the activity in terms of future planning. And so, as I mentioned already, one of our biggest challenges is trying to pick a time that worked for our students. At the time, the cohort was quite small, so it worked really nicely the first. And so when you're thinking about simulation, you know, it really is essential to find an effective method, especially for online students. Forward. And so, as I mentioned, 3 students did it in person and 3 students did it virtually. I have on this slide a picture of one of our telehealth rooms. We have a full center there where we can actually do some teaching to students in different rooms, and you can see the video cam there. So that way we can see how they're doing, and then we can also conduct different scenarios. Forward. And so our simulated actor, we were blessed to work with UMass Medical Center. They have a great program where they train actors to become simulated patients. And so we met a few times to talk about the scenario and what we expected from the encounter. And the actor that we worked with actually did both years of the first project with us. So it was nice when she came back the second year because she had a sense of what to expect and was able to give us input on how we could tweak it a little bit more to make it a more meaningful experience. And so utilizing the simulated actor, it was interesting, you know, in terms of how much time things took. We noted that for telehealth simulations, they actually took longer for the folks who are joining in via telehealth because there were some technology issues. We have a community room that's kind of set up as an apartment. And so the simulated actor was situated in that apartment. The faculty was situated behind a two-way mirror. So we had the opportunity to observe the student working with the standardized patient from the mirror. And then once we moved to telehealth, we just continued in that same way, only the student wasn't in the apartment. The student was in their own home conducting the telehealth encounter. Forward the slide, please. And so after we did the simulation, we did send around an online survey. This survey was approved by our UMass IRB. It was an electronic consent, and we used SurveyMonkey. It had 20 questions, and there were 2 parts. Please forward. And so for part 1 of our survey, there were 2 questions, and we really wanted to know, have you ever participated in utilizing a simulated actor in the past? And none of the 6 students ever had that experience. And the other question was, did they believe that a face-to-face encounter could be as effective as telehealth encounters? And 5 believed yes, and 1 believed no. And then this is just a quick snapshot of all 17 questions and all like I said, this is just a quick snapshot. We did use a Likert scale, and it began with agree, disagree, and we got a good sense of what students thought of their experience when they were complete. Please forward. And so in terms of survey themes, what we learned from that experience, at least for the first time that we launched the pilot, was that 4 out of the 6 students agreed and or strongly agreed that they had increased confidence in most areas following the simulation. What was nice was that 100% of students felt by agreeing and or strongly agreeing that the environment was realistic. They felt that and they also felt that the facilitators and the patient actor were appropriate and knowledgeable about the simulation. What was most striking to me was just how much the students really appreciated the process aspect of things. And so when we talked to students afterwards and also in the survey results, they indicated how effective the experience was to actually be able to talk to the standardized patient actor afterwards. You know, because prior to, I gave the script to the actor and I said, this is the vignette that we'd like to explore. And the actor knew the certain points that she had to hit, but really the students drove the interview. So depending on the type of questions the actor was asked, she would respond to that. So what was great in the end was that if a student did not have the right diagnosis per se, you know, the actor got to say to the student, you know, when you asked me about mania, you didn't ask me about how many hours I was sleeping. You didn't ask me about how much money I spent. And so the actor really was engaging in that way. And because she understood what the goals of the activity was, could give good feedback to the student, and the student could ask the questions, and then us as faculty chimed in as well. So the debrief was, I think, one of the most powerful aspects of that activity. Forward slide, please. Okay, so in terms of findings for that first pilot, you know, students revealed a high satisfaction with simulation experience, both face-to-face and via telehealth. The highest satisfaction rate, as I mentioned, was found through the debrief. And students, most of the students wanted more. You know, that was clear in their writing, but also in the survey response that they wanted more simulation. They thought the activity was great, but they wanted to know how in graduate education could they have more simulation. out of the 3 students who drove to campus, and we did have a student drive up from Boston. And if you don't know our Amherst campus, it's about a 2-hour drive. And so it was interesting that 2 out of the three students who drove strongly disagreed that the location worked for them. In fact, all 3 students who did telehealth, however, strongly agreed that the virtual platform worked for them. So that was really interesting because, from my experience, one of the biggest questions, and, when we think about where we are today with the pandemic, on whether or not, and Heather had a great example of her relative who had this telehealth encounter and missing that kind of touch piece of it, the question of, can face-to-face really match up with telehealth? What we found from the students is that they actually preferred telehealth in terms of delivering an interview. And they thought that overall, their experience of doing the telehealth encounter for the students who did their assessment that way, they thought it was just as good, if not better, than doing face-to-face. So I thought that was pretty helpful in terms of the findings there and kind of thinking about the future, how we would work simulated scenarios with our online students. Please forward. And so VoiceThread virtual asynchronous simulation, forward. So this is a picture of me. I made my acting debut last year. And in our 3rd year, we did not have grant funding, but I really wanted to assure that our graduate students had an opportunity to participate in simulation. And as I mentioned before, there really aren't a lot of simulated activities for advanced practice nurses who are doing psychiatric mental health. So I essentially created an opportunity to have simulation using an application called VoiceThread. And so for those of you who've not heard of it, VoiceThread is an application that can be embedded in your education program. So at UMass, we use Blackboard platform. And what the VoiceThread allows is, and you can see my photo there, is you can actually upload a presentation or put a PowerPoint up, and others can respond to that PowerPoint. So if you think of your typical written discussion, instead you can have a video, and what you can have is different responses to that video from students and peers. And so I put together several slides of different scenarios and asked my students to respond to those scenarios. And you'll get to see that in just a minute. Forward. Please forward. Thank you. So the VoiceThread asynchronous simulation is an assignment that actually is 2 parts. So the first part is the students participated in a virtual case assessment during a 1-week period via Blackboard utilizing VoiceThread. So we gave students an opportunity and said between, say, Friday to next Thursday, you have an opportunity to go in, follow the slides and respond to a simulated event. Once they started the simulation, they could not restart. So they had to be ready to sit and devote at least an hour of their time to conducting this assessment. And then the second part to that was actually a written self-review of the case assessment. So the students participated and created a narrative regarding the assignment. And so they got to explore what they learned from the experience, and then the instructor got to comment on how they did in any areas that they could reflect on further. Please forward. And so the students were provided with 2 vignettes to prepare for the case assessment. The students did not know which vignette would be selected, and so there were 2. There was one vignette that was centered around suicide assessment, and then a second one that was centered around dealing with a client who had bipolar disorder. And so they were given this way in advance and told to prepare. And once they started, and they would not know what vignette would be selected until they sat down to complete the simulated activity. Forward, please. And so now is my test to share with you the video. I just want to show you a few snippets of the actual video so that you can see what the case assessment assignment is like using. So Dr. Hamilton, will you just shake your head that you can see my screen? Okay, great. And so I'm just going to take you verbally stated and written on the. So this is just to give you some. So what I'm going to do is just show you a few snippets of our case assessment. And so what I did is I put together a PowerPoint presentation with instructions and then narrated. And then what you're going to see is the student who has come in and is responding to the different slides, almost as if, at least the impression I wanted to give was that the student was virtually conducting an assessment with a client to deliver psychiatric mental health services. The other nice piece with this assignment was that students had the opportunity to learn what the telehealth rules and regulations are in their particular state. And so one of the things they had to do when they introduced themselves was to make it clear what the guidelines were in terms of expectations for the interview. So what you'll hear is a student introducing themselves and telling the client where they're located and what the expectations are. So I'm going to take you through a few snippets so you will see me play and pause. And so the beginning is just me giving an introduction of what the expectations are of the assignment. Slide segments. Once you begin this assignment, you must continue. Please plan on spending at least 1 hour. Thank you. And so this is like an overview of what the students could expect during the session. And so each slide carefully tells a student what to expect so that they're prepared. And so I'm just going to fast forward into 2 minutes so that I can show you. Oops, I went too far. How this worked. And this is the student who is giving an introduction to the client.
So I'm showing my paper, doesn't have anything on it.
Okay, so they were allowed to keep a note page in front of them, so that way they could take notes, but the note had to be empty, so that's what the student was showing you. I'm going to fast forward a little bit more here. This is the student introducing herself further. And then the video ends with the client ending the chief complaint. The student clinician is to respond to the scenario with follow-up questions and/or comments. My name is Tina Blacksford. I'm a 40-year-old woman. I'm here because I feel like my heart is racing and someone is going to kidnap me. So that was my acting debut. I won't entertain you with more of my script, but essentially I took on the role of a client with bipolar disorder. And for each slide, and this particular slide was focused on the chief complaint. The student listens to this and hears what I have to say, and then the student is to respond based on what the student heard. This is one of our other students.
I am writing some notes here. In case you have any questions, I'm just writing down some stuff so I can keep the information that you're telling me in my head. But it sounds like you've been going through a lot of stress right now. I can just imagine that feeling like somebody is following you is going to be pretty scary. I'm glad you came in, and it says a lot that you came in by yourself. You must be pretty strong to do that. You mentioned that you've never been in a psychiatric hospital before, but you had been on meds in the past. I was just wondering if you could tell me when that was and what medication you're on. And if you don't remember, maybe you have somebody, a family member or somebody that might remember. But I'd like to hear more about.
And so what was nice about this is built into each skit that I did were opportunities for the student to elaborate further and ask questions. And so what we had an opportunity to do is to see, did the student pick up on that? Will the student ask follow-up questions to that? And really that's how this assessment continues. We don't have time for me to show you the whole thing, but it really ended up being a really nice experience with our students because it gave us an opportunity to kind of freeze frame. And not only that, for students to really come in at any point in a 1 week period to sit and conduct an assessment, and for us as the instructor to comment. And what you don't see here is the second part of this is a discussion. And so other students in the class, once the assignment was done, had the opportunity to then come in and then respond and give feedbacks to students. So just as you see the small screen here with the student, you would see like maybe 7 more pop up from different responses that others had to say regarding this assessment. So that's our video. If we can go back to the slide, that would be great. And forward. And so we evaluated our students on the following criteria. So professional introduction, review of confidentiality and privacy, also assessment and safety of risks, completion of the mental status exam, and ending with provider explanation of next steps. And we gave the student feedback both after they conducted the original assessment and then following the written assessment as well. So both parts were evaluated utilizing similar criteria that you see here. Forward. And we also asked students to please give us feedback. And so this is some of the feedback from the discussion that occurred in the course, and I'll read them to you. So I most appreciated being able to formulate interview questions based on the patient's response. I also appreciated being able to hear and see back questions and responses. It gives one the opportunity to reflect on opportunities for more improvement. I most liked, of course, not when I was doing it, but what I appreciated was that there was only a minimal necessary information. So you had to do several differentials in your mind and think critically. And that's an important fact. You know, I often tell students because they'll say, well, this is all you provided us in terms of the case study. And I said, yes, you know, even when you have a client who presents in front of you, you don't always have every piece of information you need. It is your job as a practitioner to understand what you're hearing and to elicit further questions so that you can gather your data and make an appropriate plan. So I appreciated that comment because, you know, that you won't always have all the information. And that's exactly, you know, in this case simulation, I think that's what students found through that experience is they really did have to gather more data. And then lastly, I also really liked that it was an actual person speaking versus just reading from a piece of paper. And so again, that kind of further affirmed what a nice project this was in the sense that, you know, I was acting, but I really did try to take on this role, and the students really did a nice job of formulating their clinical impressions based on what they saw. And I think a lot of students actually got nervous, you know, almost as if it were the real thing in front of them because they were sitting and they had to real time provide feedback and ask appropriate questions. Forward. And so in conclusion, really case simulation with a standardized patient actor is an effective mode to provide training and can also be successfully implemented in person and via telehealth. Simulation can also be effective using other methods such as voice-thread technology. And our class discussion forum regarding the assignment was overwhelmingly positive by the 28 students who participated. What I hope to do this fall is to, now that we've had our original pilot and had really good feedback from that project, is to now conduct a second study with a larger sample size to see how a second voice thread simulation project would be received by the students in our next cohort. And so, you know, I think that this project that we've completed is timely in a time when placements are really at a shortage. A lot of students are being asked not to return to clinical placements. You know, we have to be creative in the sense of providing realms that they can learn, and simulation is an ideal realm for students to learn. So thank you. That concludes my portion.
And thank you both. We can tell that you both do at least lecture as part of what you do for a living, because you're perfectly on time. We have about 8 minutes remaining for discussion. So everyone, please go ahead and raise your virtual hand if you'd like to ask your question, and we'll unmute you so that we can hear you asking your question. Or please do go ahead and write your question in the conference app in the Q&A section, and we'll read them out loud as they come in. Who would like to be the brave soul to go first? I see no, oh, here we go. Here's a question. So having telepresence skills a great core. I think that means maybe is a great core. Can that frame also accommodate asynchronous modes as in RPM, store and forward applications, health, self-management coaching?
Yes, it can be, because I think it's useful whether synchronous or asynchronous, because how you appear to the patient or how you communicate with the patient makes a big difference in whether the patient will think the session was successful, or if it's something they would like to use in the future to manage their health. I know, Dr. Appelor, do you want to add anything to that?
No, I agree with what you were stating. And, you know, as you were talking about telepresence, I was just thinking real time of what it's like in clinical practice as well, and how important that presence is in clinical practice. You know, the same things that I would do if someone was sitting in front of me is what I try to do when I'm on the screen doing telehealth. You know, oftentimes, you know, my head is down because I am typing some notes, but when it comes to those critical questions, such as how are you feeling today, and or do you have any suicidal thoughts, my head goes right up and I look directly into the screen and I want to make eye contact. Because that presence is extremely important, and to be able to notice, did the person pause? Did they flinch? Did they look away? What was their effective response to that question? And so the presence is really essential in this work. And especially now that many of us are launching these telehealth businesses and a lot of healthcare is going to telehealth, I think that we're going to hear so much more when it comes to the importance of telepresence because of that.
So seeing no other questions, I'll throw one in for you. It's kind of a big question. And so perhaps it cannot be answered in just the remaining 5 minutes, but I wonder if you can speak to, of everything you've just described and discussed, what what of that might translate nicely to other professions other than nursing? So like other behavioral health professions or other medical professions?
Right. I mean, I think some of the points that I just made, you know, just how important it is to be present is essential. You know, I think especially in healthcare, no matter what specialty you have, people need to know that you're listening. And, you know, I know that for many, especially diverse groups and or underserved or individuals who may be going through personal struggles, if they feel that they're not received well in the presence of a healthcare provider, they may not learn. So we owe it to our clients and our patients to be present, to be aware, and to provide them with attention based on their needs. And so I would say no matter what specialty area that you're in, the presence is key to delivery of care.
Right, and also for the framework, in every allied health profession, whether it's nursing, respiratory therapy, physical therapy, and you need that education, you need policies and procedure, you need to have an accurate assessment. The way the data is transmitted is important, and recording or documentation of your interaction with the patient along with the telepresent, it's important. So it can be translated to other allied health profession as well.
That makes great sense. Okay, everyone, last call for questions or comments.
You know, I would like to say the framework, I'm in the process of developing that framework. So if you have any feedback or any suggestions, things I can add or take away, you know, feel free to share that information with me. My email address is hamilton@umass.edu. So I look forward to hearing from everyone.
Thank you for that invitation. So thank you again, Dr. Abelard and Dr. Hamilton. That was terrific. I know everyone's going to leave the session saying that. And everyone, please don't forget to provide feedback about the session in the app. I know the telehealth resource centers would really appreciate that so they can make next year's conference even better, as if that's even possible. But I hope you enjoy the remainder of your day, and thanks again for coming.